the field of microvascular surgery or reconstructive microsurgery as we call it is one of the most exciting and interesting developments which has happened in the field of surgery, and it has basically come into place in the last 40-50 years. It was mainly in the 60s and 70s when the seeds were sown, and it started in few centers in the world. And in our country, it has become much more commonly available and widely available only in the recent past, means in the last 10 to 15 years, even 15 to 20 years. There were very few centers of good where good microsurgical reconstruction was available in our country. But thankfully, now the situation is changing very fast. More and more people are getting trained and are able to provide microsurgical services to the patients. Now, what does microsurgery mean, or what does reconstructive microsurgery mean? It means the ability with the use of magnification. We use magnification in the form of an operating microscope through which we can operate on very tiny structures like the blood vessels, the veins, and the arteries which supply my finger are very small, of the size of say 1 millimeter size, and we cannot just looking at them operate on them, but using an operative microscope the size becomes magnified and we can cut and rejoin them. So if you develop the capacity to work on a very small structure, it really provides a lot of new exciting possibilities. Like, for example, by an accident, this finger gets cut. Now, this finger can be reattached to the hand so that rather than having a crippled hand for lifelong loss of finger, the patient can get a five-fingered hand back. Now, interestingly, the tissues of the body, the skin, the bone, the muscles, if they get cut off from the body, which is called amputation, they do not die immediately. They remain live or viable for many hours. In fact, even up to 24 hours. Only thing is to make them again part of the living functioning body, they need to be attached to a source of blood circulation. So if this cut finger is brought back to a good microsurgical center and it is reattached, the bone is fixed back, the small arteries and nerves and veins are attached, blood circulation in the finger will again flow, and this finger will again become a part of your functioning body. Now, we can have sometimes even much more dramatic things. The whole hand may be cut off, even the whole arm may be cut off, or a leg may be cut off. Now, you can imagine if this patient is left alone without an arm or a leg, what kind of a deformity, what kind of a cripple he has. He becomes. Now, this is where microsurgical skill comes in. If this part is brought back in time, it can be reattached and it can become a living functioning part of your body. This whole system of the treatment, this whole technique is called replantation of amputated body parts. Now, it is interesting to mention here that, like, somebody may lose his foot or leg as a result of an injury. You can use an artificial leg, and using an artificial leg, one can walk pretty decently. But unlike the leg, in the upper limb, in the hand, a loss of a hand is very difficult to recoup. Artificial upper limbs, although a lot of research is going into making artificial upper limbs, but the function of the hand, the function of the normal human hand is so complex that it is so far been impossible to replicate it by any kind of artificial hands. And whatever artificial hands have been developed and are available in the market are also extremely expensive. They have a limited lifespan, and they still don't do one of the basic functions of the hand is to feel. When I touch my hand, when I touch an object, I can feel it. An artificial hand will never be able to feel. I mean, at least so far, it has never been able to feel. And the complex function of the fingers, of all the intricate movements which the hand, thumb, and fingers can perform. You can play any musical instrument, you can work on a computer keyboard, you can write, you can eat. I mean, the number of complex functions a hand does is enormous. Artificial hands are nowhere near that kind of complexity which can be done with a normal hand. So that just shows how precious an amputated part is, and how essential, how important it is that the people around this unfortunate patient who is a victim of an amputation realize that there is a possibility, and take this patient and the amputated body part to the nearest microsurgical center for an injury joint. Another very interesting and exciting area where microsurgery has helped is the treatment of major fractures, where a lot of body tissues are lost. Skin and muscle is lost from fracture, from a limb fracture, and without having muscle or skin cover over it, the fracture will simply not heal. These are called open fractures. And 30 years back, for many times, for open fractures or compound fractures, the legs used to be cut off. But nowadays we have facilities. We can transfer tissues from one part of the body, from the thigh or from the back, take a big chunk of muscle, take a big chunk of skin, along with it is serving artery and vein, and bring it to the leg and attach it, and cover these compound fractures, compound injuries of the leg, and save these legs which might otherwise have been amputated. One more extremely exciting field where microsurgery has done a tremendous change is the field of cancer reconstruction. Now, suppose somebody has a cancer of the mouth or of the jaw or the tongue. These cancers are very common in our country. Now, the only treatment is surgical removal. So, you may end up with a big hole in the mouth. You have to remove a large part of the skin, a large part of the bone, including the jaw. And this not only would look very unsightly, his function, his talking, his eating, his swallowing, all his functions are severely affected. Now, with modern microsurgical techniques, we have the ability, we have the facility to take pieces of bone, pieces of muscle, pieces of skin from different parts of the body, like leg, and reconstruct this face, reconstruct this mouth, reconstruct this jaw to a much uh, to a level which is pretty close to normalcy, at least functionally. The patient can eat, the patient can talk. Now, this is not possible without microsurgical technique. Similarly, cancer of the breast is very common, and some of these patients are very young, and the treatment for cancer of breast in most cases is removal of the breast. And although these women do not necessarily functionally are not functionally crippled, but there is another aspect to it, and that is the psychological aspect. A breast is the symbol of the breast is the sign of womanhood, and a woman who has lost her one breast, it has been found, does have a huge amount of psychological morbidity, psychological depression, for having lost her womanliness. And with microsurgical help, we can take tissues from the other parts of body, like commonly patients who are married and who have children, have a lot of extra skin and fat in their tummy. This extra skin and fat from the tummy can be removed and made into a new breast. So, in the same operation where the cancerous breast is removed, we can take a chunk of fat and skin from the tummy and make a new breast. So, the patient goes to the operation theater with the breast, patient comes out with a breast with the cancerous breast removed. And this can have a tremendous psychological impact on the patient. And psychologically, if the patient is stable, if the patient is happy, her healing, her cancer treatment will also be good, and her post operative course will be much happier, much better than with a simply a removal of the breast or a mastectomy.